this lesson, we will review the key activity objectives for each of the 6 stages of the PRA and provide activity examples for each stage. By the end of this video, you will be able to identify appropriate activities for each stage of the progressive return to activity. The Progressive Return to Activity Clinical Recommendation is a 6-stage protocol designed to return service members to full duty after a concussion. Each stage is designed to gradually increase the intensity and duration of a service member's physical, vestibular, and cognitive oculomotor activity as they advance in the PRA process. Stage 1 of the PRA, relative rest, is initiated at the first provider visit following a concussion. The objective for this stage is to avoid provoking symptoms and to rest to promote recovery. Service members should focus on very light daily physical and easy cognitive activities which do not provoke symptoms. These activities include walking at a relaxed pace, watching TV, or light reading. Patients should avoid strict physical and cognitive rest, as mounting evidence shows that complete rest can actually prolong recovery. View video number 3 for a full description of relative rest. Stage 2 is symptom-limited activity. The objective of Stage 2 is introducing and promoting mild exertion. In this stage, the service member can perform light, routine tasks and activities that require very little head movement, such as riding a stationary bike without resistance, walking on even terrain, or performing light household chores. They can also begin simple, familiar cognitive activities, such as reading for leisure or routine computer use, as long as these activities are performed one at a time. Stage 3 is light activity. Here, the objective is to introduce occupation-specific exertion and environmental distractions. In this stage, the service member can perform physical activities that involve changes in head position, such as light aerobic exercise without resistance. They may also begin doing simple, unfamiliar cognitive tasks, such as technical reading, or they can start more complex familiar tasks, such as grocery shopping. Depending on the service member's occupational duties, they may even consider returning to work in a light duty or profile status, which would require work modifications and frequent breaks to ensure that their symptoms are not aggravated. If the service member is able to return to work with modifications, all the restriction details should be recorded on the Patient and Leadership Guide, or PLG. The next stage, Stage 4, is moderate activity. Here, the objective is to increase the intensity and duration of activities. The service member may perform physical activities that require more significant or sudden changes in head position. Resistance training, as tolerated, can also be introduced. Some examples of physical activity recommended at this stage include non-contact sports, running, hiking, push-ups, and sit-ups. Also during this stage, the service member can try increasing the intensity and duration of cognitive activities, such as navigating busy environments and following complex instructions. Stage 5 is intensive activity. In this stage, the objective is to introduce physical and cognitive activities of duration and intensity that parallel the service member's typical role. Here, they can return to their pre-injury exercise routine or training activities. After the service member has spent at least 24 hours in this stage without any new or worsening symptoms, the provider can safely perform the return to duty screening. The service member must pass both the physical and cognitive portions of the RTD screening before advancing to Stage 6 and returning to full duty. View video number 6 for a full description of the return to duty or RTD screening. There are some restrictions that apply to stages 1 through 5 of the Progressive Return to Activity Clinical Recommendation. Service members should not drink alcohol, participate in contact sports or combatives, use firearms, be exposed to blasts, or go outside the wire in a combat zone. Service members should not drive until their visual or vestibular symptoms have resolved, and they should maintain or try to reduce their pre-injury consumption of caffeine, energy drinks, and nicotine. Finally, following the return to duty or RTD screening, the service member may enter Stage 6, return to full duty. The objective of this stage is to return to all pre-injury activities. In this video, we covered an overview of the 6 stages of the Progressive Return to Activity clinical recommendation and provided activity examples for each stage. For more information, refer to the stages of the PRA table. In the next video, we will provide an overview of the Return to Duty or RTD screening.